I was looking at my papers. Councillor Waseem Zaffar to reply.
Thank you, Lord Mayor. Can I start by thanking Councillor Gareth Moore for seconding this report? I totally endorse his comments with reference to the involvement of third sector organisations and their involvement during the lifetime of this inquiry. I'm not going to take the opportunity to respond to his personal swipe because mental health is a far bigger issue than personal swipes in this chamber. Councillor Anne Underwood, thank you again for speaking in the chamber on this particular report. I totally echo your compliments of West Midlands Police. As mentioned in my earlier address, the West Midlands Police and Crime Commissioner, working with health partners and the local authority, called a summit earlier this year. What we didn't want to do is duplicate any of the actions from within that particular summit, but endorse that. And I think one of the recommendations clearly in our report asked the mental health champion, working with the third sector, support the Police and Crime Commissioner, the police and health partners with the actions highlighted in that particular summit. Councillor Paulette Hamilton, thank you for your comments. I've known that colleagues such as yourself and Councillor Mosquito for years have been very, very passionate about addressing many of the issues highlighted in this particular report. I have full faith in your capacity as the mental health champion for this local authority that you'll take this report on board and will also receive the support of the executive as you have clearly done thus far. Councillor Susan Barnett, can I once again thank you and your colleagues on the Health and Social Care Committee for your support in the evidence gathering in this report. As clearly highlighted by you, the Autism and Criminal Justice scrutiny inquiry that yourself and Councillor Karen McCarthy led on highlighted very similar concerns within that particular report. And again, we've tried not to duplicate aspects of that, but complement the work that has been addressed in that particular report. Councillor Alan Rudge, thank you for mentioning your speech at the home of the greatest football club in the world, Aston Villa. The police, without doubt, deserves a lot of credit. The day before this inquiry was launched, a panorama programme highlighted the fact that many police forces up and down this country have not got places of safety. That particular day, West Midlands Police was celebrating the fact that they've had a place of safety in this city for 3 years at the Aliester Suite at the the University of Birmingham Hospital. So clearly the West Midlands Police is leading the way. Inspector Michael Brown couldn't attend any of the sessions. He couldn't be here today either because he's advising other police forces up and down this country, as well as advising some of the ministers in government around what West Midlands Police are doing here in this region, so others can follow suit. Councillor Barry Henley, thank you very much for the concerns you raised. The partnership work is going to be essential. We totally understand and appreciate during the current financial climate, the local authority on its own is not going to be able to implement these recommendations. But partnership work, and I'm pleased that the Police and Crime Commissioner, Councillor Bob Jones, supported by my colleague Councillor Yvonne Mosquito, has pulled a chief executive level group together from across the West Midlands, which includes representation from our local authority and health partners, to try and address some of the concerns that are again raised within this particular report. Lord Mayor, Professor Vikram Patel has said that people's health is too important to be left to medical practitioners alone. People's health must belong in people's hands, and so it must. We need to reframe the discourse away from what resources the local authority has and the capacity of existing providers can deliver. Engage communities, know and say what they need. That's where Birmingham needs to be. A small pilot already exists in Change to Choose, addressing undiagnosed post-trauma stress distress in inner city adolescents in the north of our city. We need more like that. We need a structured and responsible approach to transforming responsibility in an authentic way to ordinary people, so they design and determine appropriate services themselves. A good starting point for this structured transfer is being open with information about the nature of mental health and being specific about the wide range of conditions referred to as mental illness. And we need to build from there. We need to work towards a recovery model rather than a custodial model. Much of what we have learned is common sense. That doesn't mean the consequent changes are easy to make, but knowing its turn, does that make them optional? The case for action is urgent. Thank you, Lord Mayor.
We will now move on the motion before you. Those in favour, please indicate by raising your hand. Those against, that is clearly carried. It is 4:20.